Okay, so I'm going to start with the total hip replacement patient. I'm going to ask the patient their name and date of birth to clarify I'm with the right patient, and then ask if they know what the hip precautions are, so make sure they know what weight bearing and tolerated is, that they can put as much weight on that leg as possible, as they can tolerate, and posterior hip precautions, that they can't flex past 90 or adduct past neutral or internally rotate past neutral. And I want to make sure they can say those out loud, but I also want to make sure they understand what those mean by making sure they comply throughout the treatment session. And then I want to ask the patient their pain level throughout, and I want to make sure I'm aware of their vitals too, because I am in the acute care. And before I get started, I also want to assess the surgical site. I may not want to remove anything because the nurse or doctors may not want me to, but at least look around it for any signs of inflammation or make sure that it's just healing properly. And while they're still in bed, I want to do some straight leg raises. And if they're not able to do that, then just do quad sets, or just like bring their leg up as high as they can. And so I want to have their left leg bent and bring up their right leg, and I want to have the left leg bent so they won't remotely go past 90. And I want to do 2 sets of 10. And then I want to work on hill slides for range of motion of hip flexion. And so I want them to lay down on their back and have their left leg flex as well, and use active assist range of motion with like a belt to help pull their leg up. But I also want to make sure they don't go past 90 in hip flexion by having that left leg up. And then I want to train the patient into how to go from supine to sit in the bed. And so they currently need mod assistance for the right lower extremity and min assistance for the trunk. And so I'm going to help train the patient to use the upper extremity and left lower extremity to get out of the bed. And I will help with the right lower extremity. And then after doing that, I want to work on sit to stand and stand to sit. And they currently need mod assistance, and I want to get them to min assistance. And so I'm going to get them to work on pushing on the bed, and then after standing, reaching and grabbing for the walker instead of grabbing for the walker first. And also making sure while they do that, that they don't flex their hip past 90 degrees. And whenever they sit down, I want them to back up to the bed and then reach for the bed first before they go down. And keep their right leg straight out so that they'll avoid going past 90. And I want to get her to work on this, like do 1 or 2 sets of 10. And then for standing, and so when she stands, she needs contact with the walker. And if she's just like standing on her left side, I want to get her to do a little bit of weight shifts to get some of her weight on the right side, because she has weight bearing and tolerated, so she can put weight on that right side. But whenever she's doing that, I want to make sure that she doesn't go and just like, which she's not going to want to, but lean all the way over on her right, because I don't want her leg to adduct past neutral. And then I want to train the patient in ambulation, and so how to use the walker with that. And so I'll train the patient to walk with a 2-point mod, and they may need assistance working. And so they will probably need mod assistance, and so I'll work to get them to min assistance. And we'll see how far the patient can walk before they are only able to get 4 steps. So I'll work on trying to increase their distance. So now we're on the CVA case, and I would also want to ask the patient their name and date of birth to make sure I'm with the right patient. And then I want to remind the patient to be aware of their right upper extremity because they have neglected it and don't want to cause any injury or edema to that arm. And I want to strengthen their lower extremity to help him get more independent with walking and other mobility tasks. And then, so the exercises that I want to do would be, I want to do dorsiflexion by having the patient lay supine with the foot off the table, and then I would have him dorsiflex. He can barely get through like half the range of motion against gravity, so I just have him work on that until he can get to more. And then I want to work on plantar flexion, so I'd want to have him lay prone and then just have him extend his ankle against gravity. And so I would progress to add in resistance. Right now he can just go through the full range of motion against gravity, and so I'll just work on that until I can add resistance. And then also while he's prone, I want to have him flex his knee. And he also can just like do that against gravity, and so I'd progress to add in resistance in the future. And then whenever I get the patient to sit on the side of the bed, I want to work on knee extension, and I'm also just going to do that against gravity because he can just go through the full range of motion. And I may need to like help assist the patient while they're sitting there, just like while doing that, that may cause unsteadiness. And then I want to work on marches on the edge of the bed, and he may need assistance for that with stability too. And then I would want to do some mini squats. And so this is very functional and can help increase strength for sit to stand. And so for all these exercises, I want to do 2 sets of 8 to 10. And then I would want to work on bed mobility. So help the patient go from supine to sit using the good extremities to help them. So I will get him to roll onto his right side so he can help push up with his left arm. And so I will assist the patient as needed. And then I will work on sit to stand. So I'll train the patient to push off the bed before reaching for the hemi walker with his left arm. And I will assist the patient on the right side for weakness. And so he may need like mod assistance, and so work to having less assistance. And then I will work on gait. And so I will continue to train the patient and using the hemi walker. And so I want to train the patient using the 4-point mod and using verbal cues the whole time because he has needed that. And then the patient was able to walk 15 feet, so I want to work on walking a further distance and just see how far the patient can go. Maybe take a break and then have the patient walk further until they just can't walk anymore. And then, so the patient may need a break every 5 to 8 minutes, and I will allow him to rest as needed, and maybe we can go like a longer time before he needs a break.